Mark, one question that sort of I'd like to ask is, given the ancient and old origins of TCM, and in a modern age, how do we go about sort of applying it? Is there is there a new way of using it?
Well, I think it's very important to pay attention to the research studies that have been coming out. Most TCM education in Australia at the moment, is moving towards an evidence-based medicine approach. That doesn't mean that it discounts traditional medicine. Some people think it's either or. It's not. In China in these days, Western medicine and traditional medicine and Chinese medicine are used together, and often with very good results. So they'll be getting, acupuncture alongside, Western drugs and Western consultation. Western GPs have, as I said in the article, we also view it as this type of field as complementary therapy. So Western GPs, have a lot of great diagnostic tools, and so I think our job really is to work in complement with that. The more acupuncture becomes popular, though, the more studies that are being done, the more questions that gets answered. So acupuncture has a 2,500 odd year old history, herbal medicine probably a bit longer. So there's a lot of quantitative research that's been done in that time. There's a lot of empirical observation, so we know that colon 4 Hergu is very good for mouth and face and for frontal headache because it's been used millions of times on millions of people. So there's lots of empirical observation that's an empirical wisdom that gets passed down, which is I think a great strength in TCM. A lot of for example, some of the herbal formulas that have been used for morning sickness have been used on pregnant women for hundreds of years. So we know, given that the herbal, ingredients are safe or from a good company, then we know that it's quite safe, in that sense, as obviously with a qualified practitioner. So there's lots of different research papers that are being done at the moment into acupuncture and Chinese medicine. And I think it very much depends on the context of the research that's been done. But sometimes it'll answer a lot of questions. For example, in needle depth, as I was mentioning to you earlier. So one research paper that I heard of recently talked about in fibromyalgia cases, when you use acupuncture in a very shallow sense, it can increase the blood flow a lot more than if you're needling a bit deeply. But in another case, in another musculoskeletal case, if you're needling a bit deeply, it increases the blood flow a bit more than if you're needling very shallowly. So it can answer a few questions. Normally, what we try and do is take all the information that we can. So when we're doing the consultation, we also take into account the person's medical history from a Western medicine point of view, what Western medicine diseases they've had, what sort of medication they're on, and then as well as looking at it from a holistic point of view, looking at it from in terms of Chinese medicine, in terms of balance, or in terms of, maybe they've, worked out in one gentleman I treated was, working, he was in New Zealand and he used to play soccer in the freezing cold, and so then his joints became very stiff and deformed from working in the cold, and this is very much like a cold penetration, and ended up with very severe arthritis. So that tells us, apart from any other Western medicine tools, that tells us in a Chinese medicine sense part of his holistic history, what his body's been subjected to. So we'll look at the history of it holistically, but we'll also equally take the information from Western medicine, both what the person's presenting and then also whatever research has come up. For example, if there are some herb-drug interactions, then we'll take that into account.
That was a question I was about to ask you.
Mm.
Yeah, because there are certain herbs which obviously don't mix well
Yeah.
with various pharmaceutical drugs.
Yeah. The most common one, I mean, there's debate on many of them. There are some results that show that they influence it, but it's inconclusive. As one example, when you're taking anticoagulant medication, things like heparin or warfarin or blood thinning medication, when you're using herb dunchen or saffia, that has a very strong interaction. So it's often not encouraged to use when people are on a high dose of heparin or warfarin, because it can potentize the effect. But in another sense, like in those cases, acupuncture is very good because the body's self-regulating. So it tends to balance itself out. In herbal medicine, you have to be a bit more specific. So there are some cases where you wouldn't give, you wouldn't give a pregnant woman very purgative herbs, obviously, because you can, encourage the blood flow to the uterus and contraction of the uterus, which is what you don't want, if you want to cause an abortion. So it's very important to have a qualified practitioner, in terms of herbal medicine and acupuncture. But in general speaking, with acupuncture, it's very useful when the person's on lots of different types of medications, because it tends to more balance and even out the side effects. But there's always a certain degree of caution that you have to use, if someone has a complex history.
Right.